He was a good person. He didn't deserve to die like that. Nobody deserves to die like that.
Such a beautiful person.
This loss is all the more haunting because of what else is missing.
I love you.
Peace. There's no peace with this ending.
You put your loved one in a home, counting on them to take care of your loved one. It's just terrible. It's inhuman.
Bob Toms, his family says, was a gentle soul, a retired building engineer who battled cancer and then dementia.
He was our older brother. He was amazing. He made everybody feel special.
Now he's one of the faces of a decimated generation. Susan Hines and Bill Toms are convinced their brother never had a fighting chance. It's why they're fighting for him now.
He died without dignity. He died without care. He died without his family. Amen.
That breaks my heart.
Bob lived here at Extendicare Guildwood in Toronto's East End. The long-term care facility has been in lockdown since mid-March. On April 23rd, it reported an outbreak of COVID-19.
I called them off the hook. Off the hook. Like I probably drove them nuts. I wanted to make sure they were giving him water.
Feeding him.
Staff assured them Bob was okay. When the home began to allow window visits last month, Susan and Bill rushed over.
We saw somebody that I didn't recognize in a hospital bed.
How did he look?
Skin on bone. There was nothing there. Just mouth agape, wanting to communicate, but maybe not having the strength to. He's moving and making gestures, but I don't think he had any strength to do anything.
They took these disturbing photos and say when they called out through the window for help, a staff member told them their brother had been turning down food and water.
I said, I want to see him not be able to drink. And they went and got him a glass of water, and he drank a glass and a half of water. He was looking at me, trying to tell me something. Then he'd look at them and think, like, what do you... It looked to me like he was very surprised that they were giving them the water.
It was a revealing glimpse into a home in crisis. To date, the vast majority of the 159 residents at Guildwood have been infected, and nearly 50 residents have died from the virus. Michelle Wilson's father was one of them. Her grief is overwhelming, so is her outrage.
If this had happened in a school and it was children dying, there would have been an uproar. How do we allow this? How do we have so little regard and respect for our seniors?
David Johnson's life had been full of adventure. As a young man, he worked on merchant ships in his native Trinidad before coming to Canada, where he settled into the hospitality industry.
He was creative, he was ambitious, he was determined, he was strong.
David moved to Guildwood after a series of strokes and a broken hip. He was doing well, and then COVID hit.
When you heard about COVID being in your dad's home, what went through your mind?
Panic. Panic, because obviously it's everyone's worst nightmare for anyone that we love to be locked into a facility where there are cases and you're reliant on their efforts and their expertise to contain it.
What did they say they were doing in terms of infection control?
They said that they were isolating the infected from the uninfected, that they were containing it to the east wing, and my father was in the west wing.
Her father was in a private room, presumably even safer. Michelle and her siblings kept calling to check up on him. The phone would just keep ringing.
We learned afterwards that it was because the staff was getting infected, and so they were short-staffed, and we were trying to be sympathetic and patient and cooperative, but it just reached a point where we realized that no, something's cracking here. Something's not functioning properly in the management of this outbreak.
When did that moment come for you? When did that point come?
The shocking realization was when I did the window visit. He was unresponsive. He didn't turn to me. He didn't acknowledge me. And then I heard him coughing. And no one was in the room. And I had to call someone in the room that I saw walking by, at which point they checked him. And they're like, no, he's just tired. He's fine.
But he wasn't fine. Michelle and her siblings insisted they be allowed inside on palliative grounds. When Michelle saw her father up close, he had sores on his arm and his lips were cracked.
At which point I got the sponge and wet it and put it in his mouth. He really grasped onto it. He wouldn't let it go. He was really sucking all the water out of the sponge that he could get. I did a few more of that. And then I said to him, "Dad, I love you." And he said, "I love you." And then he said, "Water." And that was his last words.
The despair of those final moments. They are the crosses families now bear. And in this shared grief, a growing demand for answers and accountability.
They're not dispensable. Like, they're our loved ones.
Exactly.
Susan and Michelle are suing the home for neglect. Audrey de Cruz is taking legal action too.
They had a duty of care. They should have had adequate staff before.
Audrey took care of her 86-year-old mother, Teresa, for 4.5 years before her mobility worsened and she needed 24-hour care. Born in India, Audrey says her mother was a young widow who worked in factories here to provide for her daughters.
She never really bought things for herself. She would spend all her money for things that we needed.
Teresa moved in a day before the lockdown. She had her own phone and on a chat in late April told her daughter her roommates were ill, but that she was okay. 2 weeks later, Teresa got a fever. When the home called to tell Audrey, that was the first time she learned about the outbreak that had started weeks before.
The hardest part was not knowing that it was happening. I have no doubt in my mind that we would have gone there the very same day that we found out. I wouldn't have cared about whether she had a bed to go back to at that point. It was life and death. Obviously, we would have got her.
The home apologized for forgetting to add Audrey to a family email chain providing updates. She was also devastated to find out her mother's sick roommates were never moved out.
These people, they were sitting ducks. They could have built a structure in the parking lot and separated the positive and the negative people. If you can't stand beside someone in a grocery store line, how does it make sense to keep positive and negative seniors in a room together 24 hours a day?
We put the family's questions to the home. In statements it says it can't speak publicly about specific residents, but says it has been updating families with regular emails and virtual town halls. And it says it is making changes to better manage the outbreak. Among them, it is now keeping sick and healthy residents apart. It's hired dozens of new staff and is deep cleaning the facility. What's more, the day-to-day management of the home is being handed over to a local health network until the outbreak is stabilized.
For Audrey, all that is too little, too late. She and her family are left with her mother's remains and the feeling that not only did the home fail to protect her, but that she did too.
I wish that I'd never put her there. I don't know if I'm ever going to be able to get over that. It's like a nightmare.
Michelle says her father and all the residents who died deserved better.
They're throwing our seniors out like they're garbage. They're just dismissing them and disregarding them and acting like they don't matter. And they're old anyway. They're just gonna die anyway. Like, it's just a complete disregard for dignity, for care, for respect. It's appalling.
It's not my story, it's his story. And if it changes things for the better,
Yes, so be it.
that's what it's
Please.
about.
Please.
Let's change things so that our elderly
Are taken care
become
of.
visible people and not hidden.
For Susan and Bill, this is their day of mourning and a day of reckoning too, for all the lives left to end with so little grace. Ioanna Roumeliotis, CBC News, Toronto.